everybody, my name is Emma Freeman. Today we'll be talking about improving patient-centered care through effective communication. This is a case analysis for a specific patient named Nigel who had kind of a rough experience in the emergency room. I wanted to thank you for the opportunity to speak with you today, and I believe that this case speaks directly to our commitment to high-quality, compassionate, and ethical care. This case involves a patient named Nigel, and he was a non-English speaker who sought emergency care while visiting in the United States. What unfolded during his visit reveals critical gaps in communication and coordination that ultimately failed him as a patient and deeply affected his family. Today, I'll walk us through what went wrong, the emotional and ethical consequences, and how adopting patient-centered care strategies could have prevented these failures and improved outcomes for everybody that was involved. Okay, so let's start off with the introduction. I really wanted to highlight the error, the result, and the goal of this whole case. This obviously involved a non-English speaking patient where no interpretive services were provided. This led to poor communication and clarity within Nigel's care and a very unethical delivery of his cancer diagnosis. The goal is to analyze the breakdown of these events and to be able to propose better approaches for future care. For Nigel's case, it represents a scenario that we have to be prepared to handle routinely within our healthcare institutions, especially given our increasingly diverse population. Nigel was a father-in-law visiting from abroad, and he began feeling unwell and was taken to the emergency room by his daughter-in-law, Joan. And despite Joan's request for an interpreter, the care team proceeded without consistent language support, which left both patients and family members feeling confused, distressed, and ultimately alone to process a life-altering cancer diagnosis. The objective of this presentation is to identify the care delivery gaps in Nigel's experience and demonstrate how patient-centered care and evidence-based strategies could have drastically improved the quality of care and the trust within our system. So next, I kind of wanted to give you a more in-depth case overview, with the highlighted points being that Nigel was sick while he was visiting, that Joan, his daughter-in-law, requested an interpreter, which was not maintained, and that he had testing done, a long wait, and really abrupt cancer news. So to go more into detail, Nigel had been feeling sick in his home country for many weeks, and he was visiting his family, but he didn't want to tell them just because he didn't want to worry anybody, but it got bad enough to where they started to pick up on it on themselves and urged him to go to the emergency room. Joan, his daughter-in-law, like we mentioned, she accompanied him and immediately requested an interpreter because Nigel does not speak English. So they did have one with the physician when the physician briefly examined Nigel and ordered the blood tests. But after that, he left, and the physician didn't come back, and hours passed with no communication, and the interpreter was gone, obviously. Nobody checked in, and Joan stayed in the room, and she was afraid to leave in case somebody returned. Eventually, a nurse came in and quickly just mentioned that he would need an oncology follow-up appointment and the side effects of chemotherapy, and then left. There was no physician, no interpretation, no consent, and no explanation. Joan had to break this news to her father-in-law in a language that she only partially speaks, that he had cancer. This was a human failure for this case. Okay, so next we need to go over where the communication failed here. To kind of highlight those, obviously, starting with number one, the interpreter was not present during very key conversations. There was no updates or reassurances during the long wait, and the nurse gave complex information without making sure they understood what they were hearing. This situation, honestly, is a very textbook failure of communication in healthcare. Even though Joan specifically requested an interpreter, none was present when it really mattered the most. I mean, imagine learning that you have cancer from your daughter-in-law, who's not a clinician, so you can't ask her any follow-up questions, and she's barely fluent in your language, while you're lying there in an unfamiliar room in a foreign country. Nigel had no idea what was being said. He couldn't ask any questions, and he couldn't advocate for himself, and he couldn't even be comforted in a language that he understood. Federal law, especially Section 1557 in the Affordable Care Act, mandates that hospitals have to provide meaningful access to care for patients that have a limited English proficiency. This case shows how easily that legal obligation can be overlooked if we don't build a system that prioritizes communication as a core function of care. Okay, so next it's important that we go over the coordination and the ethical concerns of this case. Beyond the communication, there was also serious coordination and ethical lapses. First, nobody took any ownership of this patient's care experience. The physician disappeared after the exam. There was no handoff, no updates, and there was no coordination with the nursing staff. And while I can understand that the emergency room can get busy, it's important that each patient feels cared for. That's what they came here for, you know? Secondly, it was the nurse, not a physician, who brought up chemotherapy and cancer treatment. She left the room very quickly. She didn't explain or ensure that they understood, and this is very ethically inappropriate for a diagnosis of this magnitude. And third, and the most disturbing to me, is that the burden of disclosing a terminal illness was placed entirely on a family member. Joan was not prepared, trained, or supported in this moment. We have to ask ourselves, what does it say about our care model when we leave families to be the interpreters of devastating news? We would not accept this for our own loved ones, so why should Nigel's family be treated any differently? Following a visit like that, there was undoubtedly an emotional impact left on both Nigel and Joan, and because of that, their trust in the healthcare system eroded. The emotional impact of this experience cannot be overstated. Joan was in shock, frozen, and trying to summon the right words in a foreign language to explain to Nigel that he had cancer. It's like breaking his heart in a language that she barely knew. And for Nigel, during all of this, he didn't even fully understand what was happening. He could pick up on fear and that there was urgency, but he wasn't given the words or tools to ask questions or prepare himself. This was emotional abandonment. And emotional trauma like this has long-term consequences. This could completely mess up their treatment adherence, their mental health, and their trust in the healthcare system. So let's talk about where to go from here. So before I mention that a patient-centered care approach would be a key way to have made this better. And patient-centered care is more than just treating illnesses. It's about respecting patients' values, needs, and their communication styles. This also includes coordination and transparent communication, along with physical and emotional support. For Nigel's case, a truly patient-centered approach would have involved his family, and they would have supported their emotions and clearly communicated the diagnosis. This model, furthermore, emphasizes that treating patients as not just cases, but as whole people. They have unique values, fears, languages, and emotional needs. There should have been an interpreter present through every interaction. The family needed to have been included in discussions, but not burdened with communicating that clinical diagnosis. And the diagnosis should have been delivered by a qualified clinician, not a nurse, in a compassionate, clear, and culturally appropriate way. Patient-centered care is a promise of dignity and equity and humanity in everything that we do. And if we had that model, this is how this case would have panned out. Next, we need to make sure that we're using evidence-based communication strategies. So it's important that what we use is based on real-life data and results. This can include things like using qualified medical interpreters, structured communication protocols, or culturally and linguistically appropriate services standards for cultural competence. So communication is honestly and truly the cornerstone of high quality care. The Joint Commission emphasizes that hospitals must ensure interpreter services are not just available, but they're integrated within their care. Communication protocols, especially around serious illnesses, if you have it structured, it can reduce patient confusion, anxiety, and non-adherence. And the CLAS standards recommend tailoring care to patients' cultural and linguistic needs. These are not an optional thing. These are essential, especially when you're dealing with life-changing diagnoses like cancer. Okay, so next we need to go over recommendations for our system because it's really important that moving forward in the future, these types of situations can be avoided and that those future patients can leave feeling cared for. We can start by introducing the following. Starting with policy enforcement, we can ensure that interpreters are available and required for all critical conversations, which includes diagnoses, procedures, and discharge instructions. Next, we need to be able to equip clinicians and nurses with training on how to disclose serious diagnoses compassionately and professionally. And lastly, we can assign culturally competent navigators to families that are facing language or health literacy barriers to help guide them through the care process. These changes are more than just being patient friendly. They are quality and safety measures that reduce liability, improve outcomes, and strengthen the public's trust within us. Okay, so to conclude, Nigel's case highlights how communication failures and a lack of coordination can result in confusion, trauma, and substandard care. Utilizing a patient-centered care approach not only aligns with ethical and legal standards, but also deeply honors the human experience in healthcare. A couple things that I wanted to highlight here is that Nigel's case was preventable. Communication is core to having ethical and effective care, and we have to lead with empathy, structure, and accountability. This, for Nigel, his experience, it was not a failure of medicine, but it was a failure of humanity, structure, and empathy. When we make these changes to our pillars of care, we can prevent these painful and avoidable outcomes. And as leaders, we're responsible for building systems that protect not only clinical outcomes, but the emotional and cultural dignity of every patient we serve. This case and this story could have been so much different, with an interpreter in the room, a physician delivering the news, and a navigator helping the family take the next steps. This is the future that we must aim for. Thank you very much.